We're going to update you on the current confirmed cases of coronavirus in Australia. Now, the number of confirmed cases around the country has risen to 3,291. The national death toll remains at 13. There are now 685 cases in Victoria. This is after 111 cases were confirmed overnight. That's the biggest jump that Victoria has seen so far. In New South Wales, there are 1,405 coronavirus cases, still the biggest number in the state there. The ACT has 62 confirmed cases and Queensland's total is currently 555.
Now in Tasmania, 58 people have contracted the virus after 11 new cases were confirmed last night, most of which are related to cruise ships. 6 people are in ICU in South Australia, which has a total of 257 infections. Western Australia added 24 new cases, bringing that state's total to 255. And the Northern Territory has 14 cases now, after a police officer and his wife became the first people in a remote Indigenous community to test positive for the virus.
And in light of Victoria's biggest jump overnight, the Premier, Daniel Andrews, is continuing to urge people in the state to stay at home as the number of community-to-community transmissions rise. Individuals and businesses found in breach of the state's self-quarantining rules will be fined.
There are now a total of 685 coronavirus cases in Victoria. That is 111 more since I last updated you. I'll get you information about ICU and hospitalisation. I don't have those to hand, and until I get that update, I don't want to be putting those numbers out there.
Individuals can face a fine up to just over $1,600 if they are, for example, not self-quarantining as required if you've travelled back from overseas. If you are holding a wedding and you're over the numbers. If you're a business who is also not being closed and you are now opened. All of those are subject to this on-the-spot fine where people breach a directive of the Chief Health Officer. If you're a business and you think you can continue to operate despite the directive, you can face a on-the-spot fine of up to nearly $10,000. These are significant on-the-spot fines, and it is a really important additional tool for Victoria Police to send a very strong message to people that they and we are taking this very, very seriously.
Queenslanders are being told that it is still safe to go and vote in local government elections today if precautions are taken. Voters are being told to maintain a safe distance between each other and to take their own pen to polling stations.
In WA, a second cruise ship with 800 Australians on board has docked at Fremantle port as its passengers prepare to be quarantined on Rottnest Island for 2 weeks. Premier Mark McGowan says 3 planes will be used to return home hundreds of international passengers on board the Artania cruise ship, which docked in Fremantle on Thursday night.
Now, New South Wales has by far the most known coronavirus cases in all of Australia. More than 1,400 people have tested positive. 41 of the latest cases are people from the Ruby Princess cruise ship. Let's go live now to our reporter Chloe Hart, who's at the command centre in Sydney. Chloe, just update us on what the latest on New South Wales cases is.
Yes, good morning, Joe. As you mentioned, the tally in New South Wales has now exceeded 1,400. It's at 1,405 at this stage, and the latest figures we have is 186 new confirmed cases in New South Wales. We're expecting an update on the most recent numbers in the next couple of hours. The Premier Gladys Berejiklian is set to address the media around midday, so she should be able to provide an update on the most recent number of cases. And as you mentioned, in New South Wales, that's where the pandemic is being felt the most in Australia. Of the now more than 3,200 cases after the most recent figures from Victoria have come in, more than half of those are from New South Wales. So this state is doing all it can to try and control the spread of this virus. Over the last 2 days, we have seen a slight decrease in the number of cases. So the Premier will give an insight as to whether that has continued for a third day. today. One of the most recent cases confirmed has been a doctor from the Bathurst Hospital. They have been they're now self-isolating, and the doctor's staff and members of the public who came into close contact with that doctor have also been informed, and many of those will now be self-isolating. And the fallout continues from the cruise ship, the Ruby Princess. Now the number of cases in New South Wales from that cruise ship is at 162. So since then, the New South Wales government has been forced to move to block all cruise ships arriving in Sydney after there was so much criticism of allowing the 2,700 passengers to disembark, despite the fact that many people on board were presenting with respiratory illnesses, and then there were many confirmed cases of coronavirus.
And just quickly, Chloe, how are the New South Wales hospitals coping at the moment, and also looking ahead to as cases continue to rise?
Yes, so all of the hospitals around the country, and particularly in New South Wales, are really ramping up their preparedness. We are anticipating more cases, and at this stage, their job is to get ready for that. They're changing their triage systems. Some hospitals are separating sections of emergency department so that they can really try and isolate suspected cases and confirm cases. Some hospitals as well are even setting up clinics and tents outside of the hospital to deal with the people presenting with symptoms and try and manage them as best possible and keep their staff safe. There has been some concern about the intensive care unit beds in Australia. There's 2,200. Half of those are in New South Wales, but a report from the Medical Journal of Australia has raised concerns about the shortage of beds in terms of the number of cases we are expecting to see. And if those projections are right, we could see a shortage of beds as soon as this month.
Chloe Hart there in Sydney, thank you.
Thank you.
Overseas now, and UK Prime Minister Boris Johnson is the first major world leader to contract the coronavirus. Mr. Johnson says that he's been experiencing mild symptoms and will continue his duties from self-isolation.
The British Health Secretary Matt Hancock has also contracted the virus. Our Europe correspondent Linton Besser reports from London.
Boris Johnson took to Twitter to reveal the news. The Prime Minister of the United Kingdom has tested positive for COVID-19.
I've developed mild symptoms of the coronavirus, that's to say a temperature and a persistent cough.
While ordinary citizens of Britain are not being tested unless they're ill and in hospital, Boris Johnson underwent testing on the advice of the Chief Medical Officer of England, Professor Chris Whitty.
I am working from home, I'm self-isolating, and that's entirely the right thing to do, but be in no doubt that I can continue, thanks to the wizardry of modern technology, to communicate with all my top team to lead the national fight back against coronavirus.
And another member of Cabinet has also been struck by the virus, no less than the Health Minister, Matt Hancock.
A massive thank you to everybody in the NHS, working social care and right across the board on the response. I'll be continuing to do everything I can to get our carers the support that they need. And I'll be doing that from here, but with no less gusto.
While he is well enough, Boris Johnson will continue to lead Britain. But if his symptoms worsen and he has to be admitted to hospital and relinquish control, the top job will fall not to the Chancellor of the Exchequer, but to the Foreign Minister, Dominic Raab. The diagnosis is the second high-profile case in the UK this week, after the heir to the throne, Prince Charles, confirmed he too had COVID-19 on Wednesday and was now in self-isolation.
Linton Besser with that report. Now, known coronavirus infections in the United States have now topped 100,000. It is the most of any country in the world. The death toll has now passed 1,500 people.
Now, along with signing off a record stimulus bill of more than $3.5 trillion Australian dollars, President Donald Trump has called up the Coast Guard and military reservists to help deal with the crisis. North America correspondent David Lipson reports.
Well, it's rush hour on a Friday afternoon in Washington DC, and as you can see, things are still pretty quiet, and that's the case in many major urban centres right across the United States, particularly in the normally bustling New York City, which has emerged as the clear epicentre of this coronavirus crisis. Currently in New York State, there are 6,000 people who are in hospital with COVID-19, and 1,500 of them are intensive care, and the fear is that in the coming weeks, that number will max out at 140,000 people requiring hospital treatment. And as such, you're seeing warehouses being converted into temporary medical facilities and hospitals all over the state. 12 in total have been announced, are currently being transformed into those medical facilities for the coming onslaught. There's another problem that's emerging in New York State, and that is those on the front lines coming down with COVID-19. Currently 300 police officers in New York have been confirmed as contracting COVID-19, and 1 in 10 members of the NYPD are currently on sick leave. That is expected to worsen in the days and weeks ahead. There is, though, a glimmer of good news coming out of New York, and that is that the rate of infections seems to be slowing. A few days ago, the number of people being infected was doubling every 2.5 days. Well, now it's doubling every 4 days. That's still bad news. It still points towards a very bad situation in the days and weeks ahead, but it does appear that after more than a week of pretty strict social isolation restrictions, there are indications that that curve that was incredibly steep to begin with may be starting to flatten out.